Restaurants, certainly among all those things slowly reopening in parts of this country, which has led to a fair number of questions from you about that. So, joining us now to answer those questions, infectious diseases specialist Dr. Isaac Bogosh. Hello to you, sir. And this first question, we've gotten an awful lot, and I've wondered about this myself. What's the risk of a cook, or a waiter for that matter, sneezing on your food, then you eat it, then you get sick?
Yeah, so certainly that might be a mode of transmission. If someone who's preparing your food or delivering your food coughs or sneezes on your food and you put the food in your mouth, remember you can get this infection through the respiratory route, not the gastrointestinal route, but those tracts are very, very close together when we're up here. So if that food or if that virus gets into the back of the throat and touches the right cells, and you've got the right quantity of virus in the back of the throat touching the right types of cells in your body, it can certainly get into those cells and infect you. If it gets just into your esophagus and stomach, it's not going to infect you. Your stomach acid will burn it up. But the cells in the back of your throat, if you have enough quantity of the virus in that area, yeah, you absolutely can get infected through that route.
So which is, I guess, why we'll see a lot of masks in restaurant settings. Next question for you. In all of the factors that make a restaurant safe or dangerous, how important is airflow?
You know, it's going to be a component, and certainly we know that places, for example, outdoor settings are safer than indoor settings. So if a restaurant, for example, is able to open their windows, that would make it a much safer environment. The other issue, too, is we're not supposed to pack restaurants. People should not be full to capacity or even anywhere near full to capacity. There should be at least 2 meters of distance between tables. And we should also be thinking about how people walk through the restaurants and the flow of traffic through the restaurants to really prevent people from clustering together. So airflow, physical distancing, hand hygiene, those are going to be extremely important components. And of course, if people can't practice physical distancing, then masks would be a very important addition as well.
I've got another quick one for you. Should we avoid long restaurant meals? Stick to quick dining?
You know, a lot of this is going to boil down to people's risk threshold and risk perception. Certainly, we know that the longer someone has a potential exposure, the greater the risk of getting this infection. But having said that, I mean, if you've already crossed that threshold to go out for dinner and the restaurant's taking steps to really mitigate the risk of bringing infection in and transmitting infection within the restaurant, you know, I think it's okay to enjoy a nice dinner, but certainly some people might want to spend a little bit less time if they're just less comfortable in those settings. You know, in general, the restaurant should be well designed, well ventilated, well spaced out to prevent people from getting and transmitting the infection there.
Hey, Dr. Bogosh, this has been helpful as always. Thanks so much for your time.
Thank you.